Good afternoon, everyone. I'm Rick Fine with Sensible Financial. We have a great webinar prepared today to help you all plan for the upcoming open enrollment season for Medicare. Sensible Financial Planning partners with Caribou, a healthcare planning company, to make it easy to identify and enroll in your ideal health plan. Clarice Fleming is a health planning coordinator at Caribou and will present today's webinar. And with that, Clarice, I'll pass it over to you.
Thank you, Rick. I am pleased to be here. So, as advertised, I'm a health planning coordinator, but really I like to say I'm an education enthusiast, which is why I'm thrilled to be here and I love this. It's my favorite time of year. My aim and goal in life is to provide education and information to help you customize your healthcare. And what I mean by that is really maximizing your benefits, getting the most out of your coverage for the least expense or cost to you. So we're going to maximize our healthcare. We're going to talk about our healthcare needs and what is the absolute most correct personal choice for each individual in making their healthcare elections so that you're empowered to go out and live your life the way you want to, and you know that your health insurance is back there doing its job in the background. So I'm thrilled to be here and to share all of this with you today. I do appreciate healthcare is not the most exciting topic ever, so I want to say thank you for giving me an hour and coming here today, but I'm going to try and make it fun. At the bottom right-hand corner, there is a chat feature, and you're going to see my colleague Josie has already said hello to everyone in the chat. Either in that chat or in the questions box, you can type questions as I go through this webinar. So if you're thinking about something and it pops into your head, don't wait till the end, type it up right away. If I have time to fold your question into the presentation, if it's relevant to what we're talking on, I will fold it in. If not, I'm going to carve out 10 minutes at the very end, and I promise to answer every single question. So I welcome the engagement, and I really want to see questions popping in so that you guys can get the most out of this webinar, because this is for you. And then let's dive in. First, why is Medicare planning so important? Why do we even care about healthcare planning and Medicare? Why am I here on a Thursday spending my hour with you? Then let's talk about the basics. Let's make sure everyone has a foundational understanding knowledge of how Medicare works so that you can make choices that are best for you. The third and most important, now that I understand everything, how do I pick the optimal coverage? How do I know what's the best possible coverage I can get? And then finally, I've picked, I'm ready to go. What are my next steps? So why is healthcare or Medicare planning so important? Well, drug prices have increased 35% between 2014 and 2022. And in that same window, healthcare prices have also increased 21%. So the cost of our healthcare is going up, 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 up like this. Yet in that same window, 95% of seniors with a Medicare Part D prescription drug plan overspent for their coverage. And this is last year in 2023. So I know you're thinking, well, what does that mean, they overspent? It means that in 2024, right now, Medicare looked back at last year, a whole calendar year from January 1st to December 31st, and said, what medications did clients actually take, their actual prescriptions that they got? Let's pull out that list, and then let's see, was there any other healthcare plan that we could have picked that would have covered those same exact drugs, but for less money? And the answer was yes, for 95% of the seniors. They could have bought a different plan and spent less money and had the exact same coverage they needed. So because healthcare costs are going up and up and up, you can't afford to be one of those 95% of the seniors that are just spending money on stuff you don't need. We really want to help you optimize those costs and finances. So let's go a little background on Medicare. First of all, it's always changing. People think, oh, Medicare is a thing. It just is. You have it. It's not. It's evolving. It's living. It's manipulating and changing as we speak. So in 1965, Medicare Part A and B were created. President Lyndon B. Johnson signed them into law. Medicare Part A does hospital and facility coverage. Part B covers your doctors and healthcare professionals. But in 2003, they invented something called Medicare Part C, also known as Medicare Advantage. This is where private insurance companies are approved to sell Medicare plans. And they are on the marketplace advertising their services. In 2006, the Medicare Modernization Act expanded Medicare to cover drugs, prescription drug coverage, also known as Part D. It's easy to remember, D for drugs. So what astounds me here is that from 1965 to 2006, our grandparents didn't have any coverage for their prescriptions. They just paid out of pocket for all of their medications and drugs, no health insurance. So this was a huge sort of adaptation. It doesn't stop. In 2022, the Inflation Reduction Act became law on August 16th, and this is going to have drug pricing reform. So we're going to lower the prices of prescriptions through negotiations, or we're going to hope to. They're going to have inflation rebates for prescription drugs. There's going to be improvements to the Part D drug plan coverage design to include a maximum out-of-pocket. So that Inflation Reduction Act is so robust that they had to make an implementation timeline that lasts 6 years. Starting in 2023, we saw insulin was limited to a $35 copay. Last year in 2024, they eliminated catastrophic coverage. Now in 2025, starting this January, we're going to see a maximum out-of-pocket cap for prescription drugs of $2,000 per person. So if you previously were on a medication that was costing you $20,000 or $30,000 a year, and it's a covered drug, you're now going to be capped at $2,000. Huge savings for many Medicare beneficiaries across the country. But that has a knock-on effect, and I'm going to explain more about how we're going to see effects on that law in our presentation. But you can see still over the next 4 to 5 years, we have more implementation coming in. So every year Medicare is introducing something new. Not only is Medicare changing, but we're changing. So you might be approaching 65 for the very first time and you're new to Medicare and you're like, I don't even know what I'm looking at. This is so different. You might have a college-age child who's on your current health plan and they're turning 26 and you're thinking, well, now that they're going on to their own health plan and I'm ready to retire, retirement is another one. Maybe you've worked and you're past 65. You've always taken your employer plan. You've never really thought about Medicare, but you want to retire. So now you're being forced into Medicare once you retire. You might have retiree benefits. Moving. This is a big one I see in retirement. A lot of my clients tell me that they're moving to be closer to the grandkids. Oh yeah, we're going to move over to where my daughter lives or my son or wherever. So people who have 2 houses, sometimes they have a main home and a vacation home. Many of them are retiring to their vacation home permanently, and so they're shifting. So what healthcare they had in one state is now going to transfer to another state. So all of these life changes also mean healthcare planning is important. So I have some questions coming in, and I love it. I turned 65 in June, and my wife is 62. I'm still working, and I have large healthcare insurance for my wife and myself with a health savings contributions, or we make health savings contributions. If I don't file for Medicare now, will I be penalized later? Excellent question. And I'm going to pause this question, Jim, because I want to answer it when we get to the drug plan part. There is a specific change with this Inflation Reduction Act that could cause those penalties to apply, but might not. So we're going to talk all about employer benefits and how that works. So thank you for bringing that up, and we will get to that. So Medicare is income-based. In a nutshell, just like your taxes, the more money you make, the higher the bracket you should be in. Same thing with Medicare. They're brackets. And the more money you make, the higher your bracket. This income acronym, it's terrible, IRMA is what they call it. It stands for Income Related Monthly Adjustment Amount. That basically means it's income-based. So your IRMA has a 2-year look-back period. So right now in 2024, we're looking back 2 years to 2023 and 2022 and what your income was back then. Next year in 2025, we're going to look at your 2023 income, and that's going to forward feed for 2 years to your 2025 premiums. So the way you're going to read this is you're going to look across the gray column. The first column is if you're filing individually. The middle column is if you're married filing jointly. And then the last column is if you're married filing separately. Scroll down till you find your income bracket. And then once you've found it, then scroll to the right. The first blue column is your premium for Part B. And the second blue column is your premium for Part D. Yes, Joan, we are going to share a recording and the slides of our presentation after, so you can go back and refer to them or share them with a spouse or a friend if you need later. Great question. I want you to have access to this information so you can go over it as much as you need. So Medicare has a fork in the road. Oh, let me just pause on this 1 second. I forgot a very pivotal point. Let's say you have a great year in 2023, this year. You sold your business, you sold your house, you retired, you had a huge income, And now you're going to transition into a nice, low, moderate, fixed retirement income. In 2025, you're going to be paying your IRMA, or income related monthly adjustment amount, based on this huge 2023 year. And that may not be true for what your retirement life is actually like now. There's a form you can fill in, SSA 44, stands for Social Security Administration 44 form, where you basically tell the Social Security Administration, hey, what I'm making today is not a good indication of, or what I made 2 years ago, rather, sorry, it's not a good indication of what I'm doing right now, what I'm making right now, and I would like to have my IRMA adjusted. And they can review for that. One important call out, when I say income, I use this term very lightly. What I specifically mean is your modified adjusted gross income, MAGI. That's an important distinction, because if you're getting distributions or anything from your investments or capital gains or anything like that, it can adjust that number. So connect with your financial advisor and specifically identify what your modified adjusted gross income is, so you can find your right bracket and decide if you need to fill in your SSA 44 form, or if you're happy and you're in the right bracket and everything's working. Also, you want to pay attention to these brackets. They will be changing for 2025. They haven't released the numbers yet, but we're expecting them in the next 2 weeks or so. When those numbers are out, if you're close to a bracket, like right on the cusp of either dropping down or increasing one, and you have the ability to adjust your income in retirement, it's worth paying attention to, so that you don't accidentally jump or drop a bracket without your knowledge. Okay, so back to the fork in the road with Medicare. On the left, original Medicare, which was the A and B signed in the 60s, plus a Medigap or supplemental plan, plus a prescription drug plan, Part D. 4 pieces, A, B, Medigap, D. That makes up a whole configuration for original Medicare. On the right, Medicare Advantage. This is an all bundled together, all in one Part C. Choosing between the left and the right side is very important in your first enrollment, because you have your choice to pick anything. After your first enrollment, if you wanted a Medigap supplemental plan, they can require medical underwriting, which means your doctor has to fill in a form and tell the insurance company how healthy or sick you may be, all of your patient history and your conditions, and then they can choose to deny you based on your health status. So because of that medical underwriting, people tend not to switch into that later in life. Doesn't mean you can't. I've had people do the medical underwriting and sail right through. It was easy peasy breezy. So you could definitely consider it, but it tends to be a deterrent for people. They don't want to get the whole form and the doctor and wait for the review. It's 2 weeks and then they have to see if they're accepted. So the reason why I mentioned that Medigap specifically, Part D, prescription drug plans, can change every year in open enrollment. Medicare Advantage on the right can change every year in open enrollment. The only thing that's a little bit of a stickler, a stuck in the mud, is that Medigap supplemental plan. So because of that, people don't often switch from the right to the left side. If they're on the left, we're going to stay there and just change their prescription plans. If they're on the right with Medicare Advantage, you might have a Blue Cross Blue Shield plan and then decide they're not really nice and you want to switch to United or Aetna. Or you might move, from New York to Florida, and now you're going to get a Cigna plan when you're down there in Florida. So you can change, but they're always going to be Medicare Advantage plans. So this gap, this left or right side, is a very important decision. So Part A and B, A is usually free, usually coordinated through the Social Security Administration. It covers facilities. I mentioned hospitals, nursing facilities, hospice care, home health care services. Part B has the income, the IRMA bracket that we saw, and it covers your professionals, like your doctor visits, your specialists, vaccines, and wellness visits. These only cover 80% of a claim. So let's say you have a sore throat, nothing major, but you go to your doctor to just make sure it's not strep or anything scary, and it's a $100 bill. Part B is going to pay $80, a $20 copay. No big deal. But Part A, if you had a huge surgery, like say a $10,000 hip surgery, Part A would only cover $8,000. You're now on the hook for $2,000, $2,000. And people got scared. They said, oh, that's a lot of exposure. There's no limit to that 20%. If I had millions of dollars of healthcare bills, my 20% could be significant. So that's when additional coverage comes in to fill that 20% exposure. So we're going to talk about how to personalize your Medicare Advantage coverage. And I have a question here about Part G, which is exactly where I'm going right now. So I'm glad you brought that up. Original Medicare on the left, Part A and B is automatic for you when you're 65. Medigap supplemental plan is available, and then a Part D prescription drug plan. The Medigap supplemental plans cover that 20%. That's why they're called Medigaps. They fill the gap, the 20% gap. They're sold by private insurance companies, so you purchase them, and they have to follow specific coverage guideline rules. There's 12 plans that are lettered in most states, and the most commonly recommended one is G, which is why Doreen's asking, what about the plan G? It's the most common Medigap plan. Considerations when you're looking at Medigap supplemental plans. All of the plans that are of a same letter have identical benefits. So for example, if you had a Plan G with Blue Cross Blue Shield, it's identical to a Plan G with United. They cover exactly the same thing. There's no difference. The only difference is if you like one of those companies better than another. High deductible options are available if you want a smaller monthly premium, but don't mind having a bigger exposure or deductible. And then there are state-based things that you can, some states, so state-based regulations will allow you to change your plan, others won't. So it's important to know if you live in a guaranteed issue rights state. Very few, I think there's only 6. And then there's age-based restrictions as well. So I mentioned these plan letters, don't be overwhelmed, but this is the alphabet soup of Medicare. So I've already been talking to you about Part A and Part B and Part D, D for drugs, but now we have Medigap plans. So we might have a Plan A or a Plan C or G or M and N. So some people hate the fact that they decided to use letters to name these. Along the top are all the different types of Medigap names, the letters. Going down on the left is what Medicare does not cover. So Part A coinsurance, that's the $2,000 if you had a 10 grand hip surgery. The Part B coinsurance was the $20 from your sore throat. Also, like the first 3 pints of blood. If you look at the very second to last one, it's foreign travel or emergency coverage when you're in an international country. Plan F does have the most check marks, but this is the one that's been sunsetted and is no longer available unless you turned 65 before 2020, so 4 years ago. You can no longer purchase a Plan F. Plan G is the most comprehensive available today. And if you see G right there in the middle and go down, the only thing it doesn't cover is a Part B deductible. This year, that deductible is $240. So everything else is covered beyond that. So here's what I like to say about the supplemental plan. It's like buying a high performance vehicle, like a Ferrari. Ferraris are expensive. You put a lot of money out to purchase the Ferrari. But once you do, when you're driving it, it's very smooth and easy to drive. It turns well, it accelerates well, it brakes well. It's not going to break down. You don't need to go to the mechanic every 3 days. It's going to run really smoothly. This is what a Medigap Plan G is like. You're going to pay extra money to buy additional insurance. And then when you do, all you have to worry about is $240 deductible. Everything else is covered. It's very smooth and easy to use. It's covering all your bills. No big surprise $10,000 hip surgery confusion. It's a high performance health plan. If you couldn't afford a Ferrari, I would be in this situation. I couldn't afford a Ferrari. I might consider a Plan N or even a K or L. And you can see easily looking at the K and L things, they only cover 50 to 75% of certain services. So you're going to have a much smaller premium to buy this insurance, but less coverage. That's more like driving like a Honda or a Volkswagen. It's cheaper to purchase, but it's not a Ferrari. So that's just a very simplified explanation of that. Thanks, Ed. Most of us have never driven a Ferrari. I haven't either, to be honest. I just go off of what society tells me they're like to drive. I've never had that pleasure. Someday, maybe. So when you're comparing Medigap plans, here's an example of how Caribou supports all of our friends over at Sensible Financial Planning. We do side-by-side comparisons. So you can see ACE Property and Casualty with a Humana with an AARP United Healthcare plan. All three are Plan Gs. I've already told you they're identical. They're all Ferraris. Just whether you're going to buy it from this dealership or that dealership, it's the same Ferrari. You might choose one that's well rated, an A++ plan. You might choose the middle one that has a 12% household discount. So if you get the Ferrari and your wife also gets a Ferrari, you guys both get a 12% discount. You might choose the one that's community rated, which is the third plan. And there is some slight difference to that. But ultimately, the one who's selling the Ferrari for the cheapest is the first plan, the lowest financial exposure or risk. So you can decide what your preferences are. If you want to go to a dealer that you trust their warranty, you trust their service center, you can do that. If you want to buy the cheapest possible Ferrari you can get and still have a Ferrari, you can do that. If you want to get a discount for you and your wife both buying the same, you can do that. So there's a lot of different ways you can pick an optimized Medigap plan if you were only looking at G. As I already mentioned, you can also look at A, C, K, L, M, N, any of the other letters as well. So many choices for you. 230. Someone asked, is that 200 or 2,349 a month? No, that is annual, and that also includes their drug costs. It's hard to see, and I'm sorry that this is so small, but the monthly premium is right in the middle. It's 1, 2, 3, 4 lines down. And the first one is $175 a month. I think the next one is $182, and the last one is $200 a month. That would be the monthly premium or the fixed amount that you pay to purchase your Ferrari. The estimated financial risk is including all of your premiums for a year, plus a $240 deductible, plus prescription costs, which I'm not showing you on the slide, but this client had prescription cost. Good question. So, Medigap supplemental plans explained. Let's talk about the drug plan. And I'm going to get to that first question from Jim earlier. On original Medicare, you have the Medigap, but you're also going to add the Part D prescription. And I actually am going to pause. Thank you. There was one question about the community versus age attained. So I'll go back and explain that really quickly and briefly. Age attained plans are based on the age that you are. So every year when you get older, your plan will increase the premiums based on your age. The theory is the older you are, the more healthcare you're going to use, so the more expensive you'll be. That's the theory. Community rated plans base their prices based on the number of people enrolled in the community. So super simplified co-op explanation. If there's 200 people enrolled and the bills are $200, everybody pays $1 and bills are covered. That's the idea of a community rated plan. People have said that community rated plans historically do not increase their premiums as much because when you get older, new young 65-year-olds are enrolling in the plan. The size of the community stays the same, so therefore the premium in theory stays the same. I will tell you historically, if you look back at the last 10 years of data, all Medigap plans increase. Rate of inflation, cost of healthcare, you're going to see a 1 to 3% price increase across everyone. However, if you do take the last 10 years of data, community rated plans were closer to the 1% increase. Age attained were closer to the 3 to 5% yearly increase in premiums. So they do increase less. I had a very astute client point out to me, yeah, but they start at $200 a month and the other guy started at $175 a month. So maybe they don't increase as much, but you're paying more from the first time you enroll than you would have if you gotten the cheaper plan. So if that plan is increasing at a faster rate, maybe over time they equal out. I don't actually have the actuarial data to prove that over 20 years, so I can't say, but that's the theory. Some people like the community rated because they feel like it's more stable, especially if your retirement income is fixed. And you're welcome. That's a good question. It comes up a lot, actually. So we're going on to drug plans. Standalone drug coverage is supplied by private insurance companies. Each plan will have a premium plus that IRMA, income-related monthly adjustment amount based on your income. And starting this year in 2025, we have an out-of-pocket maximum I'm so excited about. So $2,000 per person is the most you can spend for covered drugs. Interestingly enough, manufacturer coupons are not allowed for Medicare. So that's something that a lot of people are kind of surprised about if you're used to using coupons now. Let's talk about the changes. Remember I was telling you about that implementation timeline for the Inflation Reduction Act? That's like a 6-year window to get this law in place. Well, starting in 2025, your out-of-pocket cap for $2,000, I've already mentioned, is going to be great. But this is the knock-on effect that's so important. That's going to tie back to that first question we had from Jim. Some employer plans are no longer going to meet credible criteria for waiving Medicare. What does that mean, Clarice? Well, what it means is there's a law that says you have to have coverage that is equal or better than Medicare. If you do not have coverage, say you're super healthy, I never go to the doctor, I barely use my insurance, I'm just going to not be insured. I'm going to gamble and take my life into my hands and not have any health insurance. When you enroll in Medicare later, say in your 70s, 80s, or 90s, you would incur a late enrollment penalty because they would say, hey, you didn't have any type of health insurance. We're going to assess a penalty. These penalties are a monthly assessment, and they, based on how long you were without coverage, and they're put on for the rest of your life. So I had somebody who missed their window. They didn't enroll until they were 68. And so they had 3 years of not being covered according to the Medicare eyes from 65 to 68. That penalty was assessed based on that time frame, but it was going to apply every single month from 68 all the way until the end of life. So 90s, 100s, however long this person lives. And it can really add up. It can be quite catastrophic. So it's very important that you make sure from the age of 65 until the end of years that you have some form of health insurance. Employer plans are the most common to say, I'm going to stay on my employer plan, waive Medicare, especially so I can contribute to that HSA, which is an amazing benefit, and I'm not going to take Medicare. This was great for a lot of people and worked this year. However, if your employer plan has an out-of-pocket maximum that is more than $2,000, and it's very important if your prescriptions and medical care are bundled. If they're separate, if you have like a United Healthcare plan and then like an Express Scripts or a CVS prescription plan that's separate, you only need to look at that prescription plan to see if the $2,000 cap is there. But if they're bundled medical care and prescriptions all in one, you're now looking at your out-of-pocket maximum, and there's special rules for bundled or embedded care. Many employers are no longer going to qualify for credible coverage. So this is important. The laws are in place that employers they have to identify this already, and they have to notify employees who are over 65 or spouses, if you're covered under your spouse's plan and your spouse is over 65 or you are, they have to notify anyone enrolled in their health plan over the age of 65 by October 15th if they're going to meet credible criteria. And basically, there's a very complicated algorithm I don't understand that assesses the actuarial value of their plan to say, does your plan value greater or equal Medicare? If it does not, they can choose to update their plan and make it better, or they can notify you and say, we no longer count, and now you must enroll in Medicare. So the answer to the question, can I delay Medicare and stay on my employer plan? Yes, if your employer plan is credible, absolutely. Continue contributing to your HSA, enjoy that employer coverage, cover the family, keep everyone together with the comfort and the coverage that you're used to. And when you retire, you'll have a 60-day window to activate your Medicare at that point. So don't forget about your retirement. Also, this is important to know, you have to stop contributing to your HSA 6 months prior to your retirement date. So you want to keep that in the back of your mind as well. But you can definitely do that. If your employer plan does not meet credible criteria, you will need to enroll in Medicare this open enrollment starting for January 1st. So I'm reading through a few of the questions. We'll talk about prescriptions in a minute. The penalties, it's a very complicated algorithm. It's like 10% for every month that you missed of your base premium. And we can Google it on Medicare. They have a great like example A, example B, example C, and they work it out, but it's like an equation, so I can't just tell you. It starts in the $2 or $3 for a single month, and I've seen it going up to like $50 to $60 a month late enrollment penalty, so it can get quite high, and when that's assessed for every month of the rest of your life, the late enrollment penalties is a lot. Is it credible or credible? Credible. Sorry if I'm saying that wrong. It is credible coverage. This is like a legally defining term. Is your coverage credible coverage for waiving Medicare? So your HR knows that and will be able to give you that answer. They're required by law to tell you that, in fact. So the most important thing is as well, this cap doesn't apply to non-covered prescriptions. So here's an example of 4 plans that we analyzed for a client. And formulary lists is like a published list where your insurance company says, these are the drugs we are going to cover. And maybe if it's not on our formulary list, we're not covering it. The first plan, actually the first three, Cigna, and AARP, covered all of this client's medications except for one. There was one prescription that wasn't covered. So here at Caribou, we analyzed their prescriptions up to the $2,000 cap for all their covered drugs. And then what if this client paid cash for their last prescription that wasn't covered? What would their financial exposure look like? But the WellCare value script didn't cover 3 of their medications. So you can see what a huge difference that is. One company choosing to not cover 3 of my medications versus this other company that covered all but 1. And they all have drug coverage. They all have a similar prime premium, a similar deductible. But unless you check each and every prescription to make sure it's covered, you could have a very significant experience financially. So some more changes about Medicare Part D. There's going to be a prescription payment plan. So if you have that $2,000 cap on your prescriptions, you can spread that out throughout the year. So if you have a very expensive drug, instead of paying $2,000 in January and then nothing the rest of the year, you could sign up for this payment plan and spread the $2,000 out over the year and pay smaller amounts. This is really good, again, if you're on a small fixed income and you just want to have more of an even measurement of your finances throughout the year. Looking ahead, that Medicare is now eligible to negotiate drugs. And these are the first 10 drugs that they're starting to negotiate. And that's going to start coming into play in 2026 and beyond. So always changes happening in Medicare. When you're looking at your Part D drug plans, it's important that you check the formularies and check every medication and that it's covered across the board. This client was lucky. Everything was covered across all 4 plans. So they had a plethora of choices because everything was covered. I will say the quantity and the dosage are important. So like a 5 milligram pill might be covered, but the 150 milligram pill is not. If you take 1 a day, it might be covered, but if you take 5 a day, it may not. So putting in your exact medication dosage and quantity is important. So when you're comparing your Part D plans, and I'm seeing lots of amazing questions, I will try to get to them. But when you're comparing your Part D drug plans, you might have a preferred carrier, like, oh, I know United AARP is amazing. You might want to say, hey, I want the cheapest monthly premium, which is that middle plan, the WellCare value script. Or you might say, I want the lowest overall cost. And what's interesting to me is, even though you can see here, every medication was covered for all these plans, for this client, the first 2 were capped at $2,000, that maximum out of pocket, but the third one actually had lower drug costs. And though the premium, which is kind of the second circle here, is $78 a month, it's really expensive compared to $0 a month, the overall expense when you factor in the prescriptions was lower than reaching the $2,000 cap. Even when paying all of those premiums, it was factored in. So there's a lot of different moving parts here about, are my drugs covered? Is it on the formulary? How much is going to cost me under this plan? Is it a carrier I like? Is it well rated? Am I going to reach my cap or not? Do I want to pay a lot of money up front, $78 a month, but have lower expenses in the long run? Or do I want to pay $0 and then know I'm going to hit a $2,000 drug costs, but I can put it in a payment plan and spread it out? So there's different financial strategies to this as well. Everyone asks me, hey, do I need to enroll in drug coverage? I don't take any prescriptions, so why don't I just skip it? The answer, sadly, is yes. Because of those late enrollment penalties I've already talked about, if you don't have drug coverage, you'll face a late enrollment penalty. But you can always just pick the free one. See this middle plan, WellCare value script, it's $0 premium. It costs nothing to enroll, and it'll just run in the background. Maybe you get a cold and your doctor wants you to take antibiotics for 3 days. You have a plan in place. It didn't cost you anything, and you have it so you don't hit late enrollment penalties. This plan may not be available in your area. I've seen similar plans for 50 cents or $1. So if you can't find one that's completely free, don't be sad. There are very affordable plans available everywhere. This was a question. Is other coverage available for credible coverage? Yes, TRICARE is one of the credible coverages for waiving Part D. VA coverage is another. And if your spouse's employer plan has credible coverage, you can also elect an employer plan. If you take Medicare Advantage plans, Medicare Advantage plans sometimes embed Part D into them. Sometimes they don't. And you want to double check that. I had a client who enrolled in Part D in a Medicare Advantage thinking drugs were included, and they weren't. So it could be very costly. So let's talk about the other option. And I'm going to actually pause for a minute and just read through. Oh, John wants to know, how can you find out if your prescription is covered or not covered? First of all, you can call your insurance. Second of all, you can do an analysis with us here at Caribou and with your financial advisor over at Sensible Financial Planning, and we can check for you. But most of your carriers have a drug check on the website. Also, formulary lists are required to be publicly posted. So if you just Google United Healthcare Medicare formulary, it'll pop right up. It's like the first or second one. And you can download the list and then search for your drugs in the long list. I see good questions on the word credible. Thank you for correcting that. Health savings plan. Oh, this person's asking, is a health savings plan different from a 125 cafeteria pretext plan? Yes, it is slightly different. And if there's a 6-month drop period for the Section 125, I don't actually know, Ed. That is a great question. I'm going to take down your details, research that, and get back to you. If you have to drop it 6 months prior to enrollment. And I see a Chrome extension there, so hopefully that'll help confirm a credible coverage. Thank you. So I do want to, Angie asks, can I confirm if the HSA contributions have to stop 6 months before Medicare? If you are not yet 65, no, you can contribute right up until you turn 65. However, if you are past 65, if you've been working and putting into like an employer HSA plan at 67, 68, 69, and now you're going to retire, your Medicare will backdate 6 months. So because of that, you have to stop your contributions 6 months prior to your retirement date. So you give that cushion for Medicare backdating. When you enroll at 65 years old, they don't backdate. They just start on your birthday and, well, the first of your birthday month. So there's no need to stop early. It's only post 65 that you have to stop early. Is it true that Plan Ds can cancel specific drug coverage mid-year? Good question. Rarely. If a company is going like insolvent and they're losing their business or they're having to shut down, yes. If there's something significant that's preventing them for providing coverage in a specific area, they could cancel, but that would give you a window to elect a new plan mid-year. This is very, very rare. Most companies see it through to the end of the year, and then in open enrollment, they decide to pull from a market and say, we're no longer going to cover plans, or we're changing our plan. I have only seen maybe 2 in like almost 15 years that have ever actually completely folded and ceased to be trading business mid-year. So open enrollment is when everything happens. And we'll go ahead and continue on with the presentation for time. Thank you. And then we'll answer some of these questions at the end. So let's talk about Medicare Advantage. It includes Part A and B. That's for everybody. And sometimes, as I mentioned previously, it often includes Part D, or prescription plan. It's offered by private insurance companies. And the drug coverage works the same way as a Part D plan. It's just folded in. It can be cheaper, and it's going to make up all of the ads that you guys see. If you're getting flyers in the mail, postcards, you see something on the nightly news that comes up on the TV, or something on the bus, they're Medicare Advantage plans. I went to a shopping center the other day, and there was a table, and somebody was like, hey, you want to talk about Medicare? And I was like, oh my gosh, they're setting up tables at the mall now. So they're really clever in trying to reach you. Because these are private insurance companies, they're competitive. They want your business. United Healthcare wants you to pick them, not Humana or Aetna. Anthem Blue Cross Blue Shield wants you to pick their plan instead of Cigna. So they're trying really hard to reach you and to tell you about their benefits so that they can get your business, essentially. And then pre-approvals are often required with Medicare Advantage plans. So if you want to have a surgery, they might make your doctor call and get approval in advance. And sometimes they require referrals to speak with a specialist. So Medicare Advantage plans bundle everything together. You can see on the left, Part A is there, Part B, there's a Medicare Advantage, United Healthcare AARP plan, and then drug coverage, all one thing, which is really convenient. But being that it's all bundled together, it's sold by a private insurance company, you need to be careful about your network access. So what I mean by that is you have to go around and ask your doctor, hey, do you take Blue Cross Blue Shield Medicare? Or are you in the Cigna Medicare network? Are you accepting United Healthcare? You have to find a doctor who's in that network. And sometimes you go on the website and you search for your doctors on your carrier site. For example, this client had a pharmacy, CVS, 3 medications, all covered. 3 of their doctors all covered, but only one of the hospitals they liked. So that client had a choice. If I take this health plan, I'm going to have to choose to go to the hospital kind of across town instead of the one that's closer. Maybe their service is better, maybe not. But it's sometimes you need to make network sacrifices. So I don't want you to just look at the premiums on the left, because sometimes Part A and B has that IRMA, Part B does anyway, an income-related monthly adjustment amount. But people can see the $0 AARP Medicare Advantage, which is the third one down, and they'll be advertised, no monthly cost. And people say, wow, free healthcare, $0. I love it. Where do I sign up? If you look on the right, the out-of-pocket maximum, which is the second number, is $6,700, which means when you pay all of your premiums, which is that top number on the right, for 12 months, and you have a significant healthcare year, heaven forbid that $10,000 hip surgery, your out-of-pocket maximum is quite high of $6,700. So your estimated financial risk in the event of a significant healthcare year is $16,453. So try not to be just lured by the free or no dollar monthly cost healthcare. Try to look at your exposure as well. How much risk am I taking on with this out-of-pocket maximum if I have a significant healthcare year? And because I mentioned the right-hand side and the left-hand side, it was difficult to switch from one side to the other. You don't want to just think about the healthcare you need now at 65. You want to think about your healthcare in 20 years when you're 95 years old. Maybe your silver hairs are coming in and you're just getting a few wrinkles around the eyes. That's when you want to think about, what does my healthcare look like? How much healthcare will I be using? Will I be having more significant years? And what is my financial exposure long-term? So Medicare Advantage plans, they offer additional perks like vision or dental service. So routine checkups and cleanings and things like that, hearing aids and exams, fitness programs, gym memberships, transportation to doctor visits, over-the-counter prescriptions. People love these, like vitamins and wellness benefits. Sometimes health-paying utility bills or debit cards to purchase healthy food. I will say this, these are they're here to incentivize you to pick that company, to go with their plan, because I told you they're competitive. Sometimes they're great services. People really need the hearing aid or the dental services. There's other times when they're not as robust. I had a client sign up. He said, ooh, $0 monthly premium. It provides dental. Check, I'm in. Didn't read the fine print. His dental benefit was a $750 maximum per year. So his dentist kind of laughed and said, $750 is barely going to cover your teeth cleaning. It's not going to cover your crown or your root canal or anything like that. So the guy felt like he didn't really have dental coverage. He had a dental coupon or discount. I had another client who had a fitness program. Her gym membership was $100 a month and the insurance was going to cover it. She says, I'm paying $0 premium plus they're going to give me $100 a month for my gym. That's amazing. I love it. Of course I'm taking it. So everybody likes or hates these benefits differently. So it's very personal and very individualized, and you should decide for yourself if it's a perk or a benefit that you're going to use or something that's just going to get dusty in a drawer and you're never going to use it, and why do you care? So considerations when you're deciding between the right and the left. You want to talk about your fixed monthly costs. I told you about buying the Ferrari. It's more expensive to pay up front and buy a Ferrari, but then it's easy to use. Or you have these amazing Medicare Advantage plans, which are $0 monthly premium. No cost to purchase healthcare. So that's like a difference in a fixed cost. But your variable costs, when you go to the doctor, when you have a significant healthcare event, do you want a big financial exposure, $6,000 a year, or a smaller $240 deductible? Are you willing to risk higher potential? And people tell me all the time, Clarice, I'm healthy, I'm young, I walk, I hike. In fact, my mother-in-law, she plays pickleball like 3 days a week. She's in better shape than I am. And she's like, I don't go to the doctor very much. I'd rather not pay a lot of money for something I'm not using. Other people use a lot of healthcare and they need that comfort and that cushion of lower varying costs, especially if they're on a fixed income. You want to talk about your access. I talked a little bit about Medicare Advantage plans. You have to ask, are you in the United Network? Do you take Cigna? If you travel a lot, if you have 2 homes and you're 3 months in this home and 6 months in that home and then 3 months in Europe, you need to find a plan that's going to give you that flexibility to have doctors in multiple states, to travel. You might be looking at out-of-network doctors on the PPO plans, for example. And then authorizations and denials. I mentioned briefly that some Medicare Advantage plans will require you to get an authorization. Here is a list of firms and how common authorization requests are. Anthem is first, and Humana, Centene, Blue Cross Blue Shield. We have others, and overall is a 1.5 average there, but Cigna, CVS, United Healthcare, and Kaiser. Just because the requests are coming in for prior authorization doesn't mean that they're getting denied or approved. It's just which requests are most common across different firms. And it would be true in different areas as well. So interesting statistic, the number of Americans over the age of 65 is going to nearly double in the next 4 decades. It's going to reach 95 million seniors by 2060. This is going to result in millions of new Medicare beneficiaries over the next 40 years. Everyone knows this. Every insurance company is like, wow, millions of new clients. It's a new market share. It's potential. And they are getting very creative, again, to get your business. I encourage it. Let them send you their brochures and tell you all about the perks and benefits and wonderful things that they're going to give you if you sign up with them. Because the more information you have, the more you can play them against each other and find the perfect plan for your needs. Make it very personalized and really identify the perks and benefits that suit you the best. Everyone always asks me, Clarice, this is overwhelming. Just pick. What is the most popular choice? Tell me what most people take, and then I'll go with that. Well, the answer is there isn't really most. 51%, so a slight tiny majority, are eligible beneficiaries are enrolled in Medicare Advantage last year. We believe that slight majority comes from the advertisements. People see an advertisement and they sign up for what they see. But it's really slight. So either way, whether you want to go original Medicare or Medicare Advantage, it's kind of a toss-up between the two, and there is no majority answer. It's very personal. So how do you pick the optimal coverage for yourself based on all of this? A full analysis, again, coming to your financial advisor at Sensible Financial Planning and working with them and our team here at Caribou to look at what does it cost to get my A and B Medicare with a supplemental plan, with a drug plan, versus my Medicare Advantage. Side by side, what do these cost? You can see the estimated financial risk at the bottom is $16,000 versus $12,000 in this case. Let's also talk about personal preferences. It's not just about the dollars and cents or the brass tacks, as my dad calls it. Sometimes it's about my needs and my wants, and I'm willing to pay a premium to get the best coverage. This is an example of some of the preferences we ask clients about, and this is only some of them. You may have other priorities, but we ask about if you travel, if you have an HSA account, but some of them are like, I would like all of my doctors covered. Clients say to me, Clarice, I love my OBGYN. I've been seeing her for 20 years. I don't want to change. I want to keep my doctor. My cardiologist knows me. I have a relationship. I want to work with a recognizable insurance company. Maybe you want a big household name, a brand name that you see and go, I know they've been around for a while. I trust that company. You might want a low monthly cost. Maybe you're on a fixed retirement income. You don't want to buy the Ferrari. You just need a simple Honda or something affordable that you can pay each month. Maybe you want a low financial risk. This is me. I have no risk tolerance. I am not a gambler. My husband, exact opposite. He'll gamble on anything. But for me, I'm like, I don't want a big surprise medical bill because I twisted my ankle when I was hiking and I wasn't expecting it. I want my cost or exposure to be very low so I don't have a lot of fluctuating bills. You might want a highly rated plan. Maybe 5 out of 5 stars is very important to you. You want to know what customers are saying about this company. Or maybe you like your current carrier and you want to stay with them. So how different plans are optimized. You can see here, there's a star rating. If you travel a lot, you might want the 2 PPO plans on the right. You might want to have a bigger network so you can go out of network. You might want the lowest financial risk. I mentioned I'm not a risk taker. I like low financial exposure. But again, that first plan has the lowest overall financial risk, even though the out-of-pocket is higher, technically slightly. When you factor in the drug and prescription plan, that's the lowest overall cost. So having your cost optimized, having your highly rated plan, a recognizable company you trust, a wide network, these are all things that factor into helping you choose your healthcare. Analysis are very different from one person to the next. This is an example of a client. Original Medicare was a much higher premium, $527 a month, with a smaller financial risk. So more upfront to buy the Ferrari, less financial exposure in the end, easier to use, smooth driving. Medicare Advantage had a lower monthly premium, but a bigger financial risk. Switch to the next page, and now you see the premiums are still the same. Original is more expensive and Medicare Advantage is still cheaper. But when you look at the financial risk, $7,198 on original Medicare, Medicare Advantage only had a financial exposure of $4,560. So now suddenly Medicare Advantage became the Ferrari. A lower monthly cost, cheap to buy, and also no financial exposure, easy to use, smooth driving. So people tell me all the time, oh, when I signed up, I didn't know what I was doing. I asked my coworker and he told me his plan was great. Or my sister, she loved her plan. She told me to sign up for it. What I will say is what's right for one person may not be right for someone else. A different financial situation, a different prescription list, a different number of doctors can completely change the landscape of what we're looking at. So you definitely want to personalize to you and what you need, even different from your spouse, and make sure that your care is optimized. So I see lots of questions and I'm really excited to get into them, but I'm exploring the last few slides here and then we'll go into those questions. If you're not yet 65, your birthday month, the month you turn 65, plus the 3 months before that and the 3 months after is your 7-month window to enroll. So really big window to enroll. I recommend starting quite early because the Social Security Administration takes a little while to get your card ready. So you can have everything in place for your 65th birthday. How to enroll? You're going to set up your Social Security account with ssa.gov or going to the Social Security Administration. Complete your application and they're going to send you a red, white, and blue Medicare card in the mail. Then you go to Medicare.gov, and that's when you add your other coverage. Am I going to take a Medicare Advantage Part C, or am I going to get that supplemental plan, that Ferrari, and the prescription drug plan? So you can decide how you set that up. Open enrollment. If you're on Medicare, you can change your plans every year from October 15th through December 7th. So this is the time to change those fluctuating plans and see what the market wants to offer you and what perks people are going to dangle in front of you and pick the plan that's optimized for you. And then why is open enrollment important? Your premiums can change. The out-of-pocket maximum can change. Deductibles, providers, networks, maybe your provider drops out of the network or retires or moves. The drug formulary lists are expected to change this year, and pharmacies. Not to mention your needs change. You might have a new prescription that you didn't have last year that you want to check is covered before you enroll. Health planning analyses, as you've seen several examples, side-by-side comparison of plans, we look at your budget, your healthcare utilization, your preferences, and more to kind of give you a side-by-side comparison of how things are going. So it's really helpful to just kind of visualize that. And so with that, I'm going to dive into some of these questions. And I have to scroll up quite a bit. But so does the formulary say how much a drug will cost you? No. Good question. A formulary tells you if the drug is covered, if it requires pre-authorization, if there's a quantity limit, like they're limiting only X many number of pills per month, or if there's any other like limitations or restrictions like a step therapy or something like that. If you want to estimate the cost, you need to either come to Caribou and get an analysis or go onto a costing tool online, either with your carrier, your insurance company, or like GoodRx and try to estimate the costs. Medicare.gov also does a cost estimating tool. So there's a lot of tools out there you can use, but you have to go through to do that. So this client, thank you. Somebody was chiming in that hip surgery can cost up to $43,000 without insurance. So pretty expensive. Medicare Advantage Part A is not free. Great question. That example was a very specific client who didn't qualify for premium-free Part A. This is very rare. The way to qualify for premium-free Part A is to pay your Medicare taxes from an employer here in the US for 10 years or 40 quarters, 40. So, and there's 4 quarters in a year. That's why 10 years. If you worked a decade and you paid taxes, or a spouse, so if you were a stay-at-home spouse and your spouse paid, you can qualify on their benefits. You can also qualify on an ex or deceased spouse benefit. So again, Part A is usually premium free. I think maybe 1 or 2% of clients will actually have a premium. And that was an example that you saw where someone did, but you should not expect a premium for Part A, whether you're on Medicare Advantage or Original. Part A is usually free. I just have to say usually because again, 1 or 3% might have it, but we can identify that for you. How does Medicare Enhance compare to Medicare Advantage? It's a form of Medicare Advantage. Medicare Enhance is a type where they offer additional benefits and perks specific to certain conditions and criteria, but it's another version of Medicare Advantage. You'll also see like Medicare Premium, Medicare Plus. There's lots of creative names that they want to like delineate themselves and say, hey, we're special, but it's just another form of Medicare Advantage. So I can see questions want to ask, how do you reach us? You reach out through your financial advisor at Sensible Financial Planning, and they can start the conversation and look at these. Can I change my Medicare Advantage plan in the first quarter if I'm unhappy with my choice? There is something called a guaranteed issue rights, which is 6 months. You have when you first enroll to change your plan, and you can change multiple times within that 6 months. Otherwise, you have to wait for open enrollment, which is every year in the fall, October to December, and new plans kick off January 1st. Oh, and thank you, Josie. She's posting wonderful things for me. I'm going to switch over to the other questions. If you can change your plan every year, why does it matter to look for when you're 95 or not? Great question. Well, the Medigap supplemental plan, that one I kept talking about with all the letters A, B, C, G, N, F, K, L, I keep mentioning it as a Ferrari. Those plans require medical underwriting to change. So you can't change them every year, or you could, but they're going to ask you about your health status, and depending on how healthy you are, they can deny you. So getting into a Medigap supplemental plan now, easy peasy. When you're 95, they're going to look at your health conditions and they're going to say, whoa, you're expensive. We're going to deny you and not let you into a Medigap plan. So because that one plan kind of gets harder and harder to change into, we tell people, think about the care now and when you're 95. Think long term. If you ever think you're going to want one of those plans, consider enrolling now. If you know you're going with Medicare Advantage, it doesn't matter. You can change your Medicare Advantage plan every year. So you don't need to worry about that. It's only if you think you might want a supplemental plan either now or when you're 95, you really should be making those choices early on. What if a new expensive Oh, good question. If a new prescription is given to you in the middle of the year and it's really expensive, there's nothing you can do. If your plan covers it, you'll be capped at $2,000. If they do not cover it, it is not covered until open enrollment in the fall when you can change your plans. It's very important when your doctor goes to prescribe something to start asking questions like, is there a generic available? Are there any other medications that treat this condition that work the same? Let me check with my insurance what's covered, what's not. I've had clients even on something as severe as cancer say to me, oh, my insurance will cover one cancer medication, but not the other. When I asked my doctor, hey, does it matter? They went, no, they're much the same thing. I could flip a coin. It doesn't matter. And it's like, okay, well, if this is the difference of cost, it's huge to me. So you want to have that conversation. I have also had doctors say, yes, this is very important. That drug is nothing like this other one, and your healthcare needs this specific prescription. There's something called a formulary exception, where you can request with your insurance to have an exception to cover your prescription based on your medical need. Your doctor writes it and can send it in for you, and it can be a lifesaver. So consider that as well. Is there ever a need for a drug plan if you're a veteran? If you're happy with the VA, no. the VA is amazing and covers prescriptions great and counts for credible coverage. I've had people tell me that they were unhappy and the service wasn't working well for them and they wanted to go on Medicare, but a lot of vets I've spoken to are the opposite. They love it. It works great. They're very happy. They just ignore the drug part altogether. Great question. If your medical expenses are paid by a faith-based organization or like a health sharing ministry, do you still have Medicare penalties if you purchase Medicare when you turn 65? If you enroll at 65, no. If you didn't enroll until you were 70, yes. So it's important that you have credible coverage at the age of 65 and on. If you want both, your Medicare coverage and your health sharing ministry, you can have both. But it's important that you at least have a credible coverage at the age of 65 and up. Before 65, it's not important. How can you stop contributing to HSA 6 months for retirement? You either just, however you're contributing, if it's from your paycheck or from your employer, or if you're putting in, you just write them and say, I need to stop my contributions. This is my last date. If you're forced to retire due to illness or layoff, you can't. And so you'll need to work with your HSA provider and your employer to say, I need to backdate some of these contributions because I'm forced into Medicare. And they should work with you on that. These are great questions, and I am aware that we're a little over time. So I just want to check in with Rick and say, if you have a few more seconds, I can continue to go through with him, but I am appreciative that we are technically over. So if we need to call it a day, that's okay as well.
I think we could do a couple more minutes, sure. And
Okay.
then I can close it out.
Thank you. I see Josie's mad answering questions as well. So she's in here helping. And I love the fact that we have such an engaged audience. This is fantastic. Once I'm cleared and enrolled in Medicare Part G, can I change to a different plan? With medical underwriting, yes. It might be difficult, but if you're healthy, it is possible to do that. And I see Josie's answered that one. Can you insure? Yep, I think I've actually hit the bottom maybe. Are there insurance agencies up here in New Hampshire that advertise consult advice at no cost to the consumer? They're front and get paid by the insurance companies because they're linked to so many inns. You know what? Basically, the question boils down to, are there any thoughts about using agents? Agents can be amazing. Some agents will pass their commission on to you. Others don't. As this one says, the agents are getting paid by the insurance companies. Keep in mind that with any agent, they have a broker relationship. They have a commission. So if they say get paid 10% commission from United Healthcare and only 7% from Blue Cross Blue Shield, they're likely to push United because that 3% extra commission. So you want to always take what they say with a slight grain of salt, but you can ask. If you say, how are you getting paid for this? What is your commission on this plan? And they're honest with you and they're forthcoming. Some of them have an arrangement that's the same across the board. They say, I get the exact same flat rate payment no matter who I sell. That's fantastic. So you know that their advice is unbiased, that it is neutral. We like to call ourselves plan agnostic because we don't do any sales or brokerage. So we have no alignment or loyalty with any particular company. And I try to promote them all somewhat equally because to Caribou, we believe in just giving you the information and letting you make that choice. So,
and Clarice, some of those paid agents, those commission agents, they get, I think their commissions are higher for Medicare Advantage. Is that correct?
Absolutely. Yeah.
So you need to, if you're going to use them, you need to keep that in mind. So.
Exactly. So I think there's a lot of great questions. I might have missed one or two. And if I did, I apologize. It was a very active list and this is fantastic. I would say reach out to your financial advisor, say that you want to talk about healthcare planning, and we'll get connected and we'll continue this conversation through your analysis and through your questions at that point. But I mostly just want to say thank you for welcoming here and for giving me this opportunity.
Thank you, Clarice. This has been great. And thank you, everybody, for joining us today. If you are a client of Sensible Financial and you would like to explore the health planning analysis that Caribou offers, this is a free service to you at this time. We will cover the cost. Just get in touch with me, rick.fine@sensiblefinancial.com. And if you are not a client yet and you'd like to explore your financial planning needs and how we may be able to service those needs, including health planning analysis through Caribou, please feel free to get in touch. Again, rick.fine@sensiblefinancial.com. Thank you for attending.
Thank you, everyone.